I'm about to tell something that could save a life. And it has to do with a simple habit done 3 times a week that can literally change an aging brain and reverse part of the memory loss so many seniors are terrified of. I'm Dr. Claire Whitmore. For more than 20 years as a cardiologist, I've treated hearts, but I've always had one eye on the brain. The same arteries that feed the heart also feed memory. I've watched seniors slide into confusion and dementia after years of poor blood flow and silent mini-strokes. I've also watched other seniors sharpen up, remember more, and regain confidence when a specific kind of routine was added to their week. This is not a pill. It is not a crossword puzzle. It is something that changes the way blood, oxygen, and growth signals reach the brain. By the end of this talk, seniors will know exactly what to do 3 times a week, how long to do it, how hard to do it, even if there is arthritis or heart disease, and how to tell if it is starting to work. Seniors will also know when it is not safe to push and when a doctor's input is needed first. But that routine is not coming in the first minute. If the name is handed over too fast, some seniors will scribble down "do X" 3 times a week, feel satisfied and click away. That is exactly how real opportunities are wasted. The what is useless without the why. To make this real, consider a woman named Eleanor. Eleanor was 79 years old, a retired librarian, widowed, living alone in a small 1-story house. She still drove during the day, went to church on Sundays, and baked cookies for visiting grandchildren. On paper, her health looked relatively typical. Blood pressure around 140/80 on one medication, cholesterol a bit high, borderline diabetes, no major surgeries. She took 5 pills every morning. About a year after her 78th birthday, small changes began. Eleanor started misplacing her keys more often. She would walk into a room and forget why she had gone there. Names of neighbours she had known for years would slip away for a moment. She laughed it off as senior moments. But her daughter noticed more. "Mum, you told me the same story twice this week," her daughter said gently. "You forgot that we already talked about it." Eleanor brushed it aside. "Everyone my age is forgetful. That's normal aging." At a checkup, her daughter brought it up. "Doctor, Mum is forgetting more. Not just names, appointments, whether she turned off the stove. Is this just age?" she asked. The doctor did a quick memory screen. Eleanor could remember 3 words after a short delay but struggled with drawing a clock and placing numbers correctly. He diagnosed mild cognitive impairment and said, "This can be a normal phase before dementia, but sometimes it stays stable. Do puzzles, stay social, maybe take some vitamin D. There's not much to reverse it." Eleanor heard that and quietly translated it into, "There's nothing that makes this better." Over the next year, the changes accelerated. She once left the kettle boiling until it burned dry. She got lost driving back from a supermarket she had used for 20 years. She began opening the same kitchen cupboard over and over, forgetting what she was looking for. Her daughter tried to help. She bought workbooks of word searches and Sudoku. Eleanor sat with them for a few days, then gave up, saying her eyes hurt. She walked less because she was afraid of falling. Most days she sat in her chair with the television on, moving as little as possible. No one ever addressed the health of the blood vessels feeding her brain. No one ever explained that the same risk factors threatening her heart, high blood pressure, high cholesterol, borderline diabetes, no regular physical activity, were starving the memory centers in her brain. Then came the turning point. One afternoon, Eleanor's grandson came over with a school project. He asked her simple questions about her own childhood for a report. Halfway through, she became flustered. She could not remember the name of the town where she grew up. She could not remember the name of her elementary school teacher, a woman she had told stories about for years. After he left, she sat at her kitchen table and cried. "My mind is slipping away," she thought. "Nothing can be done." 6 months later, she had a small stroke. She woke up one day and could not move her right hand properly. Her speech was slurred. In the hospital, imaging showed several old silent strokes in addition to the new one, tiny areas of brain damage from years of poor blood flow and uncontrolled vascular risk. From that point, the decline was much steeper. She needed help dressing. She could no longer manage bills. Within 2 years, she moved into a memory care unit. Here is the most painful part. A large portion of that trajectory could have been slowed, and some of the early memory loss could have been partially reversed if someone had given Eleanor specific, evidence-based guidance in those first visits, instead of a shrug and a puzzle book. What if, when her daughter first said, "She is forgetting more," the doctor had replied differently? What if he had said, "Some of this is normal aging, but some of it is not"? The good news is that certain targeted habits, especially ones that help the heart pump more blood to the brain, have been shown to increase the size of the memory centers and improve test scores in older adults. Let's talk about how to get this into the week, 3 times a week safely. What if Eleanor had been guided into a program that used her body, not just her brain, to rescue her memory? That is where the 3 times a week routine comes in. To understand why it works, seniors need to picture the brain in a new way. Inside each of our skulls sits a 3-pound organ that depends completely on blood flow. The brain is only about 2% of body weight, but it consumes about 20% of the body's oxygen and energy. It has no fuel tank. It needs a constant stream of oxygen-rich blood every second. If that stream is reduced even a little, day after day, certain regions suffer. One of the most important regions for memory is the hippocampus. Think of the hippocampus as the brain's memory librarian. It helps sort new experiences, file them, and retrieve them later. It is also one of the few areas of the adult brain where new nerve cells can be born, a process called neurogenesis. With age, and especially with uncontrolled blood pressure, cholesterol, and diabetes, the hippocampus tends to shrink. In many seniors with memory complaints, brain scans show smaller hippocampi than those of sharp-thinking peers. For many years, medicine assumed that was just normal aging. Then some remarkable studies started to appear. In one study published in the Proceedings of the National Academy of Sciences, researchers took older adults, average age in their late 60s, who were largely sedentary. Half were assigned to a program of brisk walking 3 times a week for about 40 minutes each session. The other half did stretching and toning exercises that kept heart rates low. After a year, the walking group had larger hippocampi on MRI. Their memory centers had grown by about 2%. In contrast, the stretching group's hippocampi had shrunk by about 1%, the usual direction for aging. The walking had essentially reversed 1 to 2 years of normal hippocampal shrinkage. At the same time, memory test scores improved in the walking group. They did better on tasks that depended on the hippocampus, learning new word lists, remembering where things were on a screen. Seniors who had thought their memory loss was a one-way street actually showed measurable improvement. Other trials, including a famous one in JAMA that looked at walking and simple home exercises for older adults at risk for dementia, found that about 150 minutes a week of moderate activity, roughly 30 minutes, 5 times a week, or similar combinations, significantly slowed cognitive decline and improved certain memory scores compared with control groups. More recently, the finger study in Finland combined moderate physical activity, healthy diet, cognitive training, and vascular risk factor management in seniors at risk of dementia. Over 2 years, those in the intervention group had better overall cognitive performance than those receiving usual health advice. Taken together, these studies point toward a powerful conclusion. The brain, especially the hippocampus, is more plastic in older age than previously believed. It responds to blood flow and effort. The question then becomes, what is the most practical, powerful, and safe dose for seniors, especially after age 60, to help reverse some memory loss? The answer for most older adults who are medically stable is a very specific form of moderate intensity aerobic activity, done at least 3 times a week. In plain terms, moving the large muscles, legs, arms, trunk, in a rhythmic way for 30-40 minutes, 3 days a week, at a pace that raises the heart rate and breathing modestly, but still allows conversation. For most seniors, the simplest and safest form is brisk walking. Why walking? Because it is something many seniors can do in some form. It requires no equipment beyond safe shoes. It can be done indoors in malls or hallways in bad weather, and it directly trains the heart and blood vessels to deliver more blood to the brain. Here is what that 3 times a week routine looks like when it is done correctly. On 3 non-consecutive days, for example, Monday, Wednesday, and Friday, seniors set aside about 40 minutes. The first 5 minutes are gentle warm-up, slower walking around the home or area, moving arms, rolling shoulders. Then for the next 25-30 minutes, the pace is increased to a level where breathing is a bit deeper, speech is possible but singing would be difficult, heart rate is elevated but there is no chest pain, severe shortness of breath or dizziness. The last 5-10 minutes are cool down, with the pace gradually returned to normal and some light stretching. This is not a stroll to the mailbox and back. It is not a sprint either. It is the middle ground, often described as moderate intensity. Why 3 times a week? Because in the brain studies, this was the minimum pattern that seemed to consistently change hippocampal volume and memory scores. Once a week was not enough. Daily is wonderful if tolerated, but for many seniors, 3 focused sessions is what fits life and energy best. There is a second, crucial layer to add to this: The brain likes to be challenged and interested while it is getting this increased blood flow. That means that combining walking with mentally engaging tasks seems to add extra benefit. This can be as simple as walking while naming all the animals that start with each letter of the alphabet, walking a slightly different route and paying attention to new details, walking with a friend and discussing news or telling stories, not just walking in silence. The brain loves novelty and effort. Pairing that with increased blood flow from walking is a potent combination. Now, an important question arises. Isn't this dangerous for seniors with heart disease? The answer is, it can be if done carelessly, and it can be life-saving if done thoughtfully. Before starting a new walking routine, especially at moderate intensity, seniors with any of the following should talk with a doctor: history of heart attack, stent or bypass, known heart failure, severe valvular disease, significant arrhythmias, uncontrolled blood pressure or diabetes, chest pain or pressure with exertion. In many cases, doctors will be delighted to hear a senior wants to start walking more and will help design a safe, gradual plan. Sometimes a stress test or supervised cardiac rehabilitation is recommended first. For seniors without major heart disease, starting slowly is still wise. That may mean beginning with 10 minutes of comfortable walking, 3 times a day, 3 days a week, and gradually merging those into longer blocks over weeks. Alongside walking, other movements such as simple strength training with light weights or resistance bands 2 days a week helps maintain muscle and balance, which in turn makes walking safer. But when it comes to memory reversal, the research signal is especially strong for the aerobic piece. To illustrate the difference this kind of routine can make, consider another senior, Harold. Harold was 72, a retired electrician. He started noticing he could not remember phone numbers as easily. He walked into the kitchen and forgot why. He once got a bit turned around driving to his daughter's new house, despite having been there several times. His wife noticed he repeated questions. At a checkup, his doctor performed a brief cognitive screen. Harold's score suggested mild cognitive impairment. Blood pressure was 150/86. LDL cholesterol was 132 mg/EL. Fasting glucose was 112 mg/EL. He was told, "This is concerning. There is higher risk of developing dementia. Some medicines might slow it a bit. Do puzzles." Harold's daughter, however, had heard about exercise in the brain and asked, "What about walking or other activity?" The doctor admitted that evidence was emerging and referred Harold to a cardiac rehabilitation and brain health program. There, a nurse explained the same principle being described here. The goal is to flood the hippocampus with blood and growth factors 3 times a week. That means walking or cycling or swimming at a certain intensity. We will start slowly and watch the heart very closely. For the first month, Harold walked on a treadmill in the rehab center, 3 days a week wearing a monitor. At first, he could only tolerate 10-15 minutes at a slow pace before fatigue. Over weeks, his endurance grew. By month 3, he was walking 30 minutes at a pace that raised his heart rate into the moderate zone, with no chest pain, only pleasant tiredness. At home, he and his wife began walking around the neighborhood on the same days. They chose routes with slight hills. They practiced naming words in categories as they walked, or remembered songs from their youth and tried to recall all the lyrics. They turned it into something they looked forward to, not a chore. His cardiologist adjusted medications to bring blood pressure into the 120s to low 130s at home, started a statin to lower LDL below 70, and worked with Harold's primary doctor on his blood sugar. In other words, the whole vascular system was being addressed, not just the brain. After 9 months, Harold's repeat cognitive screening showed small but real improvements. He remembered more of the word list. He performed better on drawing tasks. His wife reported that he got lost less often in conversation, tracked plots of TV shows better, and remembered appointments more reliably. He still had some lapses, but the direction of change had shifted. An MRI as part of a research study he joined showed that his hippocampal volume had remained stable. In some measures, it had slightly increased, in contrast to the expected shrinkage for his age. The storyline of his memory was no longer a straight downhill slide. It had flattened, even ticked upward a bit. The difference between Harold and Eleanor was not that Harold was younger or lucky. It was that his care team recognized that cognitive decline is not just a brain problem, it is a blood vessel and lifestyle problem, and that the hippocampus can respond to the 3 times weekly challenge. A few common worries need addressing. Many seniors ask, "Am I too old for this to work?" Studies have shown benefits in adults well into their 70s and even early 80s. The brain's plasticity does not disappear at 60. The exact degree of reversal or slowing will vary, but the direction of change improves and benefits extend beyond memory to mood, sleep, and balance. Others say, "What if walking hurts my knees?" For those with arthritis, options include indoor walking on softer surfaces, water walking in a pool, stationary cycling, or seated marching with the legs combined with vigorous arm movements. The principle is the same: move large muscles rhythmically, raise heart rate modestly, 3 times a week in a way joints can tolerate. A physical therapist can help design a joint-friendly routine. Some seniors wonder, does mental activity alone, like puzzles, do the same thing? Brain games can help maintain certain skills, but they do not improve blood flow and vascular health the way moderate aerobic activity does. The most powerful combination for memory appears to be physical activity that also engages the mind, not one or the other alone. Other seniors fear, what about falling? This is a real concern. That is why walking should start in safe environments: indoor tracks, mall corridors, flat sidewalks with good shoes, preferably with a companion at first. Practicing balance exercises and light strength training helps. If walking outdoors is too risky, indoor treadmills with side rails or supervised group classes may be better. And another important point, doing nothing new is not safe. The risk of doing nothing, letting arteries stiffen, blood pressure remain high, sugar stay elevated, and the hippocampus slowly shrink, is a greater danger to independence than the controlled, gradual challenge of walking. The final layer is coordination with healthcare providers. Whenever a new symptom appears, chest pain, unusual shortness of breath, dizziness, new palpitations, seniors must tell a doctor. The walking routine may need to be paused, adjusted, or moved into supervised rehab. Medications may need tweaking. No routine is fixed forever. It must evolve with health. Seniors who have listened this far now hold a key piece of knowledge that many, like Eleanor, never received. Memory loss after 60 is not just fate, it is often the visible tip of an invisible vascular and metabolic iceberg. The same risk factors that threaten the heart, blood pressure, cholesterol, sugar, inactivity, smoking, also choke the brain. The encouraging news is that even after 60, the brain still responds when those factors are changed, especially when the heart is trained 3 times a week to send more blood upstairs. The habit itself is deceptively simple. 3 times a week, set aside about 40 minutes. Warm up, then walk, or cycle, or swim, or march in place at a pace that leaves breathing deeper but still allows speech. Add a mental task, conversation, memory games, learning a route. Cool down, log the sessions, bring that log to doctor visits. Ask, are these intensities safe? Can we aim a little higher, or should we hold here? Combine this with a plan to bring LDL and blood pressure into safer ranges. What seniors do 3 times a week in those minutes is not just walking. It is instructing brain cells to survive, grow, and connect. It is irrigating a garden that was starting to dry up. The story of memory after 60 does not have to match Eleanor's. It can look more like Harold's or even better. But it does not change with wishful thinking or crossword puzzles alone. It changes when the heart and vessels are asked 3 times a week to deliver more life to the brain. Disclaimer: the content in this script is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician regarding any medical condition, especially before starting or changing an exercise program. Never change any medication dosage or stop a prescribed therapy without consulting a doctor.